This patient has a space by relapse after treatment. To set the IPR value, we will proceed with the final setup first. We will align by adjusting the axis of the maxillary central incisor and rotation. When aligning in the mandible, control cervical protrusion by adding torque. Fine-tune the midline, overjet, and overbite. We will proceed without IPR since there is enough space. Let's start setup with layers. Since there is a space between number 11 and 21, we adjust the tip without additional expansion. Split some rotation movement into layer 2 to avoid excessive movement. Apply expansion and rotation while avoiding mandibular occlusal interference. Adjust the axis of number 31 and 32, centrifugal inclined. In layer 2, adjust insufficient rotation and evenly distribute the space by retraction. Make sure to align perfectly in this layer. Check the amount of overjet and overbite and make fine adjustments. In layer 3, we will perform space closing by retraction. Perform overcorrection by evenly distributing the overlap by 0.1 millimeters. Open Tooth Control and enter numerical values directly to make detailed movements. We will check the occlusal relationship and finish the setup. Divide the steps after measuring the amount of movement using the superimpose function. In layer 1, tooth number 13 and 41 are the teeth that have moved the most. Divide the steps based on this. If you hide the gums while measuring the maximum movement distance, you can accurately check the movement amount of the root. In layer 2, tooth number 21 and 32 are the teeth that have moved the most. Divide the steps based on this. In layer 3, tooth number 11 and 31 are the teeth that have moved the most. Divide the steps based on this. Finally, check the number of aligners through Show All Steps function.